The AI revolution in medicine, GPT-4 and Beyond, was published and immediately recommended by Bill Gates, founder of Microsoft. And even Sam Altman, founder of OpenAI, wrote an article praising the book. Bill Gates believes that in the future, AI will be used to accelerate the breakthrough of research bottlenecks and provide accurate and reliable medical advice to those who do not have the opportunity to see a doctor. Peter Lee is the lead author of the book. He believes that doctors working with AI will be an unstoppable source of new challenges and opportunities. The three CEO authors of the AI revolution in healthcare are three leading professionals in the fields of technology, medicine, and reporting. One of them is Peter Lee. Peter Lee is Corporate VP for Research and Incubations at Microsoft, where he oversees Microsoft's research labs around the world. For the past 6 years, he has been involved in AI applications in healthcare and life sciences. He has led information engineering programs at the Defense Advanced Research Projects Agency (DARPA), and served as chair of the Department of Information Engineering at Carnegie Mellon University. Kerry Goldberg has been a member of the board of directors of Microsoft. Kerry Goldberg has worked for the New York Times, Los Angeles Times, Boston Globe, WBUR or NPR, and Bloomberg News, with a long history of focusing on healthcare costs and genetic research. Isaac Kruhan, founding chair of the Department of Bioinformatics at Harvard Medical School, and has been a member of the board of trustees of the University of California, Berkeley. Isaac Kohani, the founding chair of the Department of Bioinformatics at Harvard Medical School, has been working on medical artificial intelligence since the 1990s. He is committed to using mechanical intelligence to help doctors work more efficiently and with a greater sense of fulfillment. About ChatGPT-4, Peter Lee explains that it is not like a computer. It is more like a reasoning engine, thinking like a human, but with limitations. To address the limitations of GPT-4, Peter Lee proposed 2 ways to improve the accuracy of Chat. First, Peter Lee observed that Chat is very good at finding errors. Therefore, he suggests using Chat twice and asking the second one to check the first one's errors, so as to know the blind spots of the first Chat and get a more extensive and comprehensive answer. Another way to use Chat is to let Chat use tools just like human beings to complement its own limitations. For example, using plugins to empower AI to make it work better. Therefore, Peter Lee concluded that physicians can make good use of Chat's review capabilities. For example, a physician can make a judgment based on his or her own medical knowledge and experience, and then ask Chat for its opinion on the decision. In this way, Chat's misjudgments can be avoided and physicians can be provided with new directions for thinking. The authors believe that AI can help healthcare professionals translate, record, and search for the latest research and health education. In the face of challenges such as the widening healthcare gap between urban and rural areas, the increase in the expatriate population, and overwork in healthcare. Looking at the demographic changes in the world, there are many developed countries with shrinking populations. Italy, Japan, Germany, and now China and the United States. This means that there will be more elderly people than working people, and many more health problems among the elderly than among the young. And our younger generations will not be able to fill the jobs of healthcare, nursing home workers, and all the other jobs we need to keep our seniors healthy and dignified. The same demographic issues will put a strain on the entire healthcare system. My mom and brother live in rural central Virginia, and when they go to the doctor, they have 2 different problems. First, what healthcare resources are available to them in rural areas, and can they afford it? Medicine and health are part of everyone's life, but the rising cost of healthcare and the uneven distribution of healthcare resources are huge challenges we are facing. GPT-4 may never be able to replace humans in the medical process, but it will not only allow everyone to utilize existing healthcare services, it will allow us to search for what else we can do to treat illnesses so that people can live healthier, more comfortable, longer lives. In the area of mental health, for example, there is a shortage of specialized mental health care providers. And even in Massachusetts, where healthcare resources are abundant, children sometimes have to wait weeks in the emergency room for a psychiatric bed. Taken together, we know that there is a great need for a therapeutic relationship with a GPT-4. regardless of mental illness, because of the huge unfilled workforce gap. But the causes of mental health are complex, and there is no mechanism in place to track whether or not the use of AI will cause harm. Not only is there a lack of therapists on the market, but there may be mediocre or even harmful therapists. This means that even if humans are involved in the treatment, it does not mean that no harm will be done. Ideally, AI will help improve the categorization of different patients, some of whom are well taken care of with primary care or online cognitive behavioral therapy. Others will need psychotherapy or hospitalization. Dr. Roy Perlis, a professor of psychiatry at Harvard Medical School, has long studied whether AI can be used in mental health. So I asked him my question. He concluded simply, "It's not a terrible thing to talk to a very realistic computer when you don't have an alternative treatment." But on the other hand, he emphasized that new technology should not be used as an excuse to ignore the urgent need for more mental health treatment, especially to replenish the shortage of manpower as soon as possible. Perlis also points out that psychotherapy apps already offer highly regimented cognitive behavioral therapy, which is much like a curriculum. Higher-order AI may be better suited to the diverse, supportive, and psychodynamic therapies that most people crave. The role of new AI in promoting mental health is unlikely to be one-size-fits-all, he says. It may be appropriate for people suffering from mild anxiety, depression, or other problems, but not for those who are difficult to manage or who suffer from serious illnesses. Ideally, AI will help improve the categorization of different patients. Some may be well cared for in primary care or online cognitive behavioral therapy, while others may need psychotherapy or inpatient care. A common expectation is that AI can be used to detect whether someone is suicidal. But what happens when it fails? Perlis counters that many would-be suicides now fall through the cracks, and that at least large-scale AI might find more high-risk people. Coco, a chat service that offers peer support, has caused a stir because, according to tweets from its CEO founders, it conducted an informal experiment that used chat to generate about 30,000 messages. Critics said the sudden use of AI to interact with users with fragile mental states was too crude and crossed ethical boundaries. But Coco's users reportedly gave higher ratings to messages written by the AI. For Perlis, that story is a worrying example of the extremes. "I think there's a space between letting it run its course and seeing what happens and only studying it in tightly controlled experiments," he says. "We need to figure out what that middle ground looks like, so that a lot of people can get in. But at the same time, there have to be ways to protect it and learn from it. AI healthcare isn't just a trend, it's the way things are done." And with the advent of chat, the kind of doctor-patient conversations that take place in hospital clinics now may be unimaginable. Patients not only take the online data to ask the doctor's advice, but also take the doctor's medical advice to ask chat after the initial consultation, which is like treating chat as their own medical care assistant. Many patients bring chat's feedback to the doctor for discussion when they return to the clinic. When chat is widely used by patients as a reference, doctors must know how to use this AI tool correctly in order to facilitate the communication between doctors and patients. However, when should a doctor use chat? If a patient comes into the clinic and the doctor is checking chat while asking questions, the patient may not trust the doctor's professionalism and may even wonder, "What am I doing in the hospital if I only want chat's advice?" Therefore, doctors can certainly use chat, but when to use it is a test. In the future, patients may first tell chat their symptoms at home, and then send them to the hospital system after chat has been standardized, which can greatly improve the efficiency and quality of consultation. Otherwise, some patients may talk for a long time, but fail to talk about what is uncomfortable. If chat can record symptoms in advance and synchronize them with the doctor's consultation, it will allow the doctor to turn his or her eyes from the computer screen to the patient, observe the patient's physical condition, and provide more comprehensive and caring care. In addition to helping patients, AI tools can also create health benefits for healthcare professionals. The world is experiencing a severe nursing shortage, and the tight workloads in healthcare facilities are causing many caregivers to leave the White Tower. Hospitals not only need to take care of patients, but they also need to keep healthcare professionals. in order to provide stable and quality healthcare services in the long run. AI has become an important tool to reduce the workload of healthcare professionals by streamlining workflows and taking care of complicated paperwork. Many of the smart hospitals listed in Europe and the United States have the goal of improving the working environment for healthcare workers. Therefore, it is important to create smart hospitals that allow healthcare workers to get to and from work on time. When healthcare workers have a good quality of life, patients can receive comprehensive care. GPT-4 is effective in reducing paperwork. According to a 2016 study, physicians spend an average of 51% of their work time on electronic medical records and desk work. Paperwork is important, and medical records help improve the quality of care, minimize treatment errors, maintain the financial stability of a medical facility claims, remittances, insurance, and ensure hospital compliance with government regulations. It assists in filling out basic information for hospital admissions. Typing physician consultation dialogue into prompts allows you to write a clinical record in the desired format, for example, SOAP. Identify disease codes for claims filing. Write post-visit summaries and health education. Completing a PI review program for medications that are required by law or insurance conditions. GPT-4 understands the evaluation system and makes specific recommendations to help healthcare professionals improve. GPT-4 is also useful for medical research, as it simplifies the bureaucratic process of approving clinical trials. Designing and executing clinical trials reduces the time it takes to recruit subjects by analyzing electronic medical records and helps analyze data collection. Simplified jargon so that trial participants better understand the goals, risks, and benefits of the trial. Parsing large amounts of literature from related studies and structuring and integrating large amounts of data from papers and clinical reports. Assist in writing and formatting papers for publication. Integrate biomedical knowledge into basic research. It is very encouraging to see what AI can do. The reasons often cited for why computers or AI cannot replace humans, such as lack of empathy, inability to think, lack of emotion, inability to provide individualized answers to situations, and error crashes have been greatly reduced by the new developments in AI. Not to mention the fact that all of these deficiencies can be seen in human doctors as well. Can we really have such a powerful tool at our disposal? Take navigation as an example nowadays. Many people will heavily rely on navigation when driving, and they simply cannot recall how they used to use paper maps to reach their destinations. Is this a kind of program's control over us? And is it a kind of thinking too? Direct all the traffic flow to achieve the goal of smooth traffic flow. In any case, through the author's personal use of AI in various medical situations, the help to medical development is clearly expected.